Hey YouTube, it's Marita and welcome to another edition of the Nurse Lounge. In this edition, we're going to talk about, is nursing whitewashed? Short and sweet title, huh? If you want to know what I'm talking about, stay tuned. Welcome back. My name is Dr. Marita P. I'm a registered nurse for 17 years. OBGYN, well baby nursery is my specialty. And I am a nurse educator, teach at HBCU, and I'm doctorally prepared. Now, I'm never afraid to tackle topics like these. So people come here for the tea when it comes to these topics because I'm not afraid. I'm not afraid at all. What's going to happen? They're going to take the video down? I could care less. It's not how I make my money. Anyway, the reason why I want to make this video is nursing whitewashed. It's because of the fact that, for one, it is. Number two, if you went to a PWI like I did, there's going to be some things that you don't even recognize as being, I won't say abnormal, but abnormal because you never have seen anything else. And we're going to talk about those things today. First and foremost, let's keep in mind Florence is considered to be the mother of modern day nursing. Okay. So nursing was built off of a premise of racism. And you're wondering why, or some of us wonder why racism is still an issue in nursing today, because the whole foundation was built on that. So if you went to a certain institution, right? If you went to a PWI, and if they are ones who talked about, Florence's truths, then congratulations, you had a good instructor. But I can almost guarantee you probably 99.9 out of 10, they did not talk about the essence of who Florence was, outside of her being the mother of modern day nursing, and didn't talk about the ideas that she stole from Mary Seacole, and they didn't talk about Harriet Tubman in nursing. They never talked about Mary Mahoney in nursing. They never talked about Jessica Scales in nursing. Nothing like that, huh? So, Florence had no desire for minorities and men to be in nursing. Minorities was definitely a no-go. And then men were to be considered the help. So if you watched like old psych movies where they have white men who were orderlies were kind of like the help. They're the ones who would wear the white outfits, the white scrubs or white whatever. And they'd be the one to drag the psych patient away because they were acting ugly. And they would drag them into a padded room or have them on that vest that everybody wears, at least in the movies, and throw them into the room. They were the strength. They only needed them for their strength. They did not want them to be nurses. Florence didn't. There was a place for men, and nursing was not it. They were highly discriminated against. There were lawsuits even filed against boards of nursing for not allowing men to join nursing. We're not talking about that in this video. Of course, their minorities were not recognized as such. And so nursing has been whitewashed, and it started with Florence. So when you're wondering why today, 2021, going into 2022, while we are still having the same issues, you can think Florence. Why? Why would that be important considering that this was back in the 1800s? Because the thing is, the narrative is still followed in the nursing programs today. The nursing programs today follow that same mentality. Now, do they let men into nursing? Of course they do. Do they let minorities into nursing? Of course they do. But we already know that sometimes it's not what it seems. There is plenty of discrimination, plenty of racism against minorities and men in nursing, and people don't want to talk about those things. But we're going to talk about those today. So have you ever noticed, in terms of the whitewashing, Have you ever noticed that in your nursing classes, when you talk about the history of nursing, that you haven't talked about many men, if any, and you haven't talked about many other pioneers of nursing outside of Florence? You may have talked about Margaret Sanger. You may have talked about some of the other ones that were Caucasian, but you never talked really much about the black ones, unless you went to a HBCU or unless you just had a great instructor who made sure that you understood all sides of nursing, not just the Florence side of nursing. Also, how many of you went to nursing school, probably at a PWI, which means predominantly white institution? How many of you went to nursing school and all your mannequins were Caucasian? All of them. And for me, I didn't think anything of it because of the fact that I just didn't think anything of it. I just never thought anything of it when I went to nursing school. We didn't have any black or brown skinned simulators or mannequins. They were all white. So now I teach at HBCU, right? And I'll put a picture up here of our Mama Natalie, which is the one who has the baby. She's black. She is dark skinned at that. And our executive director made a statement one day. She said, being that we're at a HBCU, she said, I want my simulators, my mannequins to look like my students. And I thought that was the most wonderfulest, not a great word, thing that I have ever heard. She wants her simulators to look like her students. And if you go into our room, our simulation rooms, you will see all kinds of pretty shades of melanin. We have Hispanic, we have Asian, we have black, light skin, dark skin, and we do actually have Caucasian mannequins as well, or simulators as well. So I was never so proud to see, I'm like, wow, I never knew they even made these. Now, as old as I am, how did I not know they made them? I just had never seen them. Which tells me, like, okay, how long, what other schools are doing this? Does your school have different shades of melanin, various races when it comes to your simulators? Or are they all one shade? Let's talk about that. That's the whitewash. So again, everything I'm saying, it stems from nursing school. Have you also noticed that when it comes to even how you're taught in nursing school in terms of giving and getting report? Why is someone's race important in terms of knowing how to care for that patient? So for instance, today we have a 33-year-old African-American female. She's a G5, P5, meaning she's been pregnant 5 times, have 5 babies, yada, 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 yada. Why does it matter if she's African-American with report? It doesn't. But we are taught in nursing school, when you're writing your subjective data or your objective data, that they are whatever, 51-year-old African-American male, da, 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 da. I'm beginning to believe that a lot of the health disparities that we have is not really per se linked to just race. It's not linked to just race, but it's linked to our identification of race. Hypertension is not a black thing. It's not a black thing. Hypertension is not a black thing. It's not. Health disparities and how educators and physicians are taught may make us have more health disparities when it comes to certain populations of people, but it's not a black thing. Everybody can have hypertension, obesity, whatever you want, diabetes, you name it. But risk factor wise, they will say the risk factors are increased for certain races of people. No, it's because how medicine's been whitewashed as well. I won't get into medicine. We'll just stick with nursing. But so I digress. I say all that to say in nursing school that we are bred that way. Why is it that we covet, you will notice that we covet certain people in nursing school and other people struggle in nursing school? They will tell you black people have been known to have a harder time in nursing school than white people. Is that true? Yes, it is. But who do you think creates that narrative? See, these are conversations that y'all not ready to have yet, but I am. And so I encourage you to definitely make comment in the comments about, once you are able to open your eyes and see the world from a different lens, then you'll be like, okay, you know what? Wow, I did not realize that. Just like how my eyes were opened when I went to my institution and saw minority simulators. I'm like, who would have thought of such? Who would have even thought? I mean, I'm sure they were creating them, but the thing is, why would any school just want one color mannequin, race mannequin? I mean, it's whoever buys them. But the thing is that they're biased. Whoever buys the mannequins, say we're going to order all the white ones. When our student body is diverse, I automatically assumed they were going to buy white mannequins when I knew we were going to order new ones. And never thought about the fact that since we're HBCU, maybe we should have some diversity even with our simulators, mannequins. This is how it is whitewashed. And I'm not gonna belabor this video. But those are some things that you will see. When it's whitewashed, I have another video about the aesthetic of nursing, which I will tie to this one at some point. But when it comes to being whitewashed, think about where you see where your minority nurses at in terms of where do they work. I always say this. I don't really enjoy med-surg at all, but med-surg to nursing is like McDonald's to the workforce. It's like entry level in some people's eyes. And then, of course, there's specialties. Now, med-surg is a specialty within itself, right? Nothing wrong with med-surg. But the thing is, you will find a whole lot of pocket of minorities in med-surg. You will. A lot of minorities will be in med-surg. And then they're trapped there, have a hard time getting out. I'm going to say this in this video, like I said in the other video. If you happen to live in Atlanta, Detroit, Chicago, Philly, Houston, Jacksonville, Florida, places like that there's a lot of minorities there, we're not talking about you. So just take yourself out the scenario. I'm talking about the world as a whole. I'm talking about the United States as a whole. In the United States, in terms of black people, only represent 10%, less than 10% of the population of nurses in the United States. 10%. But yet we represent about 13% of the U.S. population. So we're disproportionate. Hispanics only represent 3% of the nurses, or yet represent 18% of the U.S. population. Again, disproportionate. You have Caucasians represent about 76%-ish of the U.S. population, and then also reflects about the same, about 75 to 76, depending on what literature you look at, of nurses. They're proportionate. So they're the only group who's pretty close to being proportionate. Everybody else is disproportionate. Tell me, why is that? Because it's been whitewashed. And because we keep on following with this Florence Nightingale narrative, is why it will continue to be the way it is. Unless we say, nope, we're going to do something different. So when I teach my classes, I do bring up Florence, but I also bring up her racist ways in my classroom. I don't per se put it quite like that, but I do say that she did not want minorities and men in nursing. That's the truth. I tell the truth in my classroom. And I also bring in all the other issues with nurses and nursing. And, you know, here's another one. This person right here, her name is Margaret Sanger. I was going to say this for another video, but I'm going to go ahead and do it in this one right here. Margaret Sanger, she is the person who's the founder of Planned Parenthood. Now, Planned Parenthood, as you know, is not a bad thing, as some people want to have negative connotation. They do things other than abortions in Planned Parenthood. Not an issue. But guess where Margaret Sanger wanted to place those Planned Parenthoods? Guess where she wanted to place them? The same places that you have your buy here, pay here's, your liquor stores, not the wine and spirits, but the liquor stores. Same places that you have your payday loans. In the hood, yes, hood, ghetto, whatever you want to call it. That's where she wanted to place them strategically. Because, again, not wanting blacks to have babies. Didn't want brown babies. Did they teach you all that in nursing school? I bet you they didn't. So, again, this feeds into the whole whitewash notion that I just spoke of. We have to do better. We have to know our history in nursing. Do you know your history in nursing? We have to know our history in nursing and who truly provided us a foundation to who we are as nurses. If you're a minority nurse, it wasn't Florence. It was Mary Mahoney. And I'm going to do another whole video on the Black history of nursing. So, and I'll do another one on men in nursing as well. But anyway, for today, we're going to end it with this. Again, that is why we're having difficulty today in nursing, because of the fact that we were never supposed to be here to begin with. So we are against the grain. So I want to leave you with that. Hopefully, you know, this is something for you to think about. For any of y'all in school, when you go back to your classes in the spring, if you're still if you're out of class, yeah. So you can go look at your mannequins. What do they look like? Do they look like you? Do you have mannequins that look like anybody else besides you, depending on who's watching the video? So those are the little things. Those are the little things that I'm talking about. What does your faculty look like? Does your faculty look like you? No matter who's watching this video, does your faculty look like you? And do you have faculty who don't look like you? Do you have men as faculty who's teaching you? Think about that. That's why we have to change the face of nursing. This whitewash of nursing, we need to water that down. We need more ethnic minorities and men in nursing. And all the reasons that I've talked about in this video are the reasons why. And all the reasons we've talked about in this video are the reasons as to why we have patient outcomes the way we do. It is directly related. Do the research. So when you think about health disparities, who do the health disparities actually affect? I'll wait. Who do they affect disproportionately more? I'll definitely wait on that. Again, this is what I call the whitewashing of nursing. So definitely think about it. Follow me on IG. Follow me on TikTok if you so choose. Help me get to 3K. So subscribe if you can. Comment below. Share the video. And until the next time, you all take care. Bye-bye.